in my kind of hopes for healthcare, I thought I'd share with you a couple of my reflections. In Australia, we've had fire, we've had flood, we've had COVID-19. And what's really heartening for us now is we're starting to see some real recovery and regrowth in our country. And that's filling us with great optimism. We know that it's affected everybody across the world. We're feeling a bit more optimistic, aren't we, because our vaccinations are starting. But we're aware we've got a new normal. And what have we learned in the last 12 months? And how are we going to use it to help us? And how can we use it to help safety in the new normal? Part of that's got to be learning. I have been absolutely amazed at how quickly we've learned, we've tested improvements and innovations at scale, we've collaborated on best practice. Usually it takes years for us to do that. And actually we've worked at a pace and momentum that we've never worked at before in the system. And one of the areas we've seen that in has got to be virtual care. It still amazes me that the context of COVID-19 was the reason that my GP finally gave me a video consult and sent me my prescriptions by text. But how else can we actually ensure we can care for people remotely, as close to home as possible? And the second hope for me has got to be what I call salutogenesis. And what is that? It's about understanding the assets of health as much as the causes of disease, and actually thinking about how we can enable citizens and communities to focus on thriving, not just surviving. We've talked about data today, and data is a massive piece of our hope. We've got improved access, but are we truly intelligent? Do we triangulate? Do we trend? Do we focus on getting it in the hands of clinicians who really, really need it? Are we transparent about it? And do we carry up enough peer review? And how we work has totally changed. In my organisation, we've worked differently. We've created virtual teams, new roles. People have been freed from bureaucracy, and we don't want to go back. We want to rethink what the word team means, and we want to create heightened connectivity in the way that we work in the future. And we know we work in a complex system. We all do in healthcare, but we've started to move away from the silos, and we need to be more understanding of the complexity of what we work in. And forgiveness, not permission, in this kind of model has got to be our mantra for empowerment. So the one thing that we have learned about this last year is definitely culture. I've heard people talk about behaviour, values, compassion everywhere I go. People certainly remember how you've made them feel, particularly when at work. And two of the strongest indicators for safe care is experience of our staff and experience of our patients. But we also know that psychological safety is absolutely paramount. People want to feel free to say what they're concerned about, what questions they have, what ideas. The presence of psychological safety is palpable in great teams. And it's been part of the biggest conversation we've had in the last 12 months with our staff, because PPE has become the biggest human factor in that space of psychological safety. People have felt really vulnerable. They want to be open and transparent. Our staff have asked us to think about highlighting their well-being every day in the practices we carry out. And we can do that through things like these safety fundamentals. Why today are these fundamentals still not consistent in every single practice we have as a team every day, every shift? How can we make them part of your DNA in your team and make them happen for every patient? The second hope I have in terms of adverse events has got to be adaptive leadership. We still treat every problem like it's got a simple solution. We want it quickly. We're not willing to think of the complexity about it. And in the world of adverse events, we still think policies and training programs will actually solve everything. What we do know is it's human factors. Human factors is about how we interact with each other. We need to train people in human factors, invest in human factors, make it part of our clinical governance processes, and all of our interactions with each other as teams and with our patients and families every day. I spoke with our consumers this week as part of our strategic plan and asked them what matters to them. And they came up with the same things that our staff came up with: respect, compassion, caring, and kindness. But it feels to them at times that we actually have lost sight of that. And their invitation was, can we be humans caring for humans? Part of being human is understanding that our future lies in working with our communities and seeing the people in our communities as assets, not problems to be fixed. And how can we really interact with people differently to make them feel in control? So my long-term ambition is for us all to lift our organisations to be as proactive and generative around safety systems as we possibly can. A lot of our staff experience us as reactive. We're not anticipating harm. We're not behaving like learning systems and learning organisations. How could we change that? We could put our hands up in a coalition for safety. We could put a will and commitment together that's different from one we've ever had, and show that collectively we want to embrace change and learn from each other and think about the future together in a fundamentally different way. And I want that change for a number of reasons. I want that change because I want my grandsons to have a future that's safer, to see a legacy in our health systems that allows more power and control to the next generation, to model and design what they think healthcare and their outcomes in terms of their own health should be. But lastly, I hope that through your conference and your forum, you'll think that all of you in this room today has got the potential to disrupt and be an innovator around all of our hopes for the future. I wish you well, and I hope that, like me, you'll want to join our safety movement for the future between Sydney and Canada. Thank you.